Maple team is, I would say, is reasonably well established at the moment. We've got a very experienced community matron.
Okay. James, this morning we were having a meeting with our...
We've got good nursing sisters working on our patch.
That was the original duck.
Was it?
That was the original.
We've been lucky in that we've had a successful integration of the social worker within our team.
But on talking to Lynn yesterday, she did mention
and we've also had another member from Hampshire County Council coming and working as a signposter for various social services that are available.
Okay, so you want some help with transport to the day centre?
I think there's been great efforts made by both Southern Health as the community provider, by the Clinical Commissioning Group, North Hampshire Clinical Commissioning Group, and a response from primary care as well, to really try and make a difference with regard to integrated working. But I've been really impressed by the attitude and the desire, the hearts and minds, if you like, to try and make this work, particularly with the response from Hampshire County Council, Adult Services, who we're really not used to working very closely with, but there's been a great effort made.
Well, I was in the army in Kenya, intelligence officer with 24 Brigade, and because of my club in London, I had reciprocal membership of the Nairobi Club. I used to go swimming there in the afternoons, and there was this rather nice lady with 2 charges. She was a nanny out there, and we were introduced by our mess doctor in the pool, wearing hardly anything. There you go. That's how we met. That was what? That was about 50 years ago. Children, yes, we've got 3 children. They're all of an age. They've all got two children each.
Mr. Wilson does require a large packet of care from the Maple team because of his long-term conditions. He is now wheelchair bound and arterial problems in his lower limbs, various wounds and pressure ulcers. He's had OT input and physio input. He has a very good relationship with his GP and myself and the team.
Lynn, I've been very impressed with the service I've got from Claire, our OT. She's providing me with lots of kit. Good things, new, nothing second-hand. I'm very impressed with her. I rely very much on my carer, my prime carer, Andrew Fernando and Lynn Aldridge, and they're all available. They all come back to me. I've got Lynn's private number, got her mobile number. I suspect it's quite unusual. I think they're all pretty good. I can't put one ahead of the other. Places it goes wrong is when the surgery or the chemist screw it up completely. They either don't send the prescriptions over to the chemist as asked to do so, or they do send them over when they're asked not to do it. And they get lost. Several times Andrew has had to just redo the whole lot. So that seems to fall apart a bit, but I can't blame that on anybody specifically. You really want to know how much I feel like I'm in the centre of decision making now and how that will pan out in the future. I think I have a good say at the moment. I have choices, which we didn't used to have. So if I have to go to hospital, I can go to Frimley or Basingstoke, or if some special man I don't know, I could beg to go there, wherever that is. So I have a certain degree of choice.
The Maple team is an integrated care team. It consists of 10 nurses. We have an allocated social worker, an allocated physio, allocated CPN. We encourage as many people to come to clinic. And we also look after lots of residential homes. I think we're building on it on a weekly basis. We have an allocated social worker now, which is a godsend, because we can actually refer to her. We come up with an action plan for, you know, how can we both work together to help this situation.
The community care team staff will come to me. It could be Lynn, it could be one of her colleagues, community sister, or the community nurses. They would have gone to see someone who they feel because of their diagnosis they're now struggling to cope. That's when I would come in, and mainly initial visit, we do them as joint visits to look at how we are going to support the individual.
We've got a great environment here now, which can only go on to progress further services.
I visit 4 surgeries: Old Basing, Odiham, Hartley Whitney and Hook. I do a drop-in centre for people to come in and see me if they want any advice with benefits, care, anything that they need on a day-to-day basis to make them more independent.
I think the challenge that we face at the moment is getting some of the IT to work together, because at the moment there are different IT systems between practices, let alone between big organisations. And these are barriers at the moment because people are effectively wasting time filling in information, putting in requests on different systems. That is one of the real challenges, which I think I hope that the CCG will be able to lead with to improve this.